Now, this month we've been focusing on the pressures on the health service, particularly the crisis in social care brought about by the UK's ageing population. Many say the key to solving it is greater cooperation between health and social care services, an approach that has been in place in Northern Ireland for many years, with care provided for some patients at home rather than in hospital. But is it affordable? Here's our Ireland correspondent Chris Buckler.
Hour after hour, people arrive at hospitals looking for treatment. But to deal with that daily pressure, staff need to keep some patients away from this building.
So far, so good.
Excellent.
Nothing to worry about.
In his living room, Thomas Wright is seeing a doctor, and in his kitchen, a nurse is preparing his antibiotics. Care a 97-year-old would normally receive in hospital.
Yes, we actually got the call from the paramedic when he was in the back of the ambulance on his way to hospital. They rang us first and we said, well, look, why don't we see him at home? So we came straight out and saw him here with his son. He was delighted not to have to make that journey. And
it matters to hospitals too. In Northern Ireland, like elsewhere in the UK, operations are regularly having to be cancelled because beds are needed for emergency care.
Now we have all year round pressures and we have such a stretch on beds that we are often unable to do elective operating.
Is that all right? That's lovely.
With waiting lists already among the longest in the UK, there have been many claims that the health service in Northern Ireland is at breaking point. At the end of last year, they published this, a 10-year plan to try to change the way services are delivered. And with this report came a stark warning. Currently, of the total amount of money that Stormont has for public spending in Northern Ireland, health and social care takes up around half. Ministers say unless there is significant change, that figure will rise to 90% within a decade.
It's already showing signs of struggle, financially showing signs of struggle. It's showing signs of struggle in terms of waiting times, and those will both exacerbate and get just a lot worse.
Unlike other parts of the UK for decades here, there's been one budget for both health and social care.
No alarms overnight?
No alarms overnight, no.
Great.
That can make it easier to offer joined up services. Mervyn's been waiting years for a kidney transplant, but with support he's able to look after his own dialysis at his house in Kilkeel. It's different to the treatment he would get 20 miles away at hospital in Newry, but there are advantages to him as well as the NHS.
It's probably at least a third, maybe in some cases half as expensive to deliver home dialysis.
And money is a concern for Northern Ireland's busy health service, where the collapse of the power-sharing government has led to uncertainty not just for politics, but also budgets. Chris Buckler, BBC News, Belfast.